And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Hello, I'm George Gordon. On Boomer Life today, we are joined by the professionals at Integrative Naturopathic Medical Center in Vancouver. And in studio joining us, naturopathic physician Dr. Katie Leah, along with Kirsten McEwen, a registered holistic nutritionist. Katie and Kirsten, welcome to Boomer Life.
Thanks for having us.
You know, we haven't, I just want to make sure, I mean, we'll talk about naturopathic.ca. Great place to get all information. Where is the clinic?
The clinic is located just at the corner of Birch and Broadway in Vancouver. So the closest major intersection is Granville and Broadway, and we're just a few blocks east of that.
All right, so you're just on the cusp of Kitsilano, right?
Yes, absolutely.
Well, we're going to talk today about, I think, something that we're becoming far more aware of in our food, in our nutrition, and in our daily intake, and something that's so important when you're developing, as we have talked previously, about the weight management plan and about feeling better, and that's how to detoxify. And a lot of us may not even understand what the toxins are that are in our systems or that we take in on a daily basis. So, Katie, why don't you lead off and tell us a little bit about yourself and some of the things that you've encountered as you've developed your practice? Absolutely.
So I am a naturopathic physician at Integrative. I have a general family practice, and I see a lot of things related to food allergy and food sensitivity, a lot of conditions related to hormonal balance. And certainly one of the things that comes up a lot in conversation with patients is, cleansing and detoxification, and how that can be a really important part of people's health program.
Kirsten, some of your background, and of course you play a major role in helping people decide or work out what's best for them to intake. Tell me a bit about yourself.
I'm a registered holistic nutritionist, and I'm a graduate of the Canadian School of Natural Nutrition, which is located here in Vancouver. And some of my own health issues about 10 years ago kind of led me into this field, and I went back to school and became a nutritionist. And in my practice, I see a lot of people wanting help with, obviously, cleansing and detoxification, but also hormone balance, food sensitivities, and stress management. And I think, my goal is always to really find simple solutions that people can implement into their daily life.
Well, this is, I guess, probably the perfect day to be talking about a spring cleaning of the system, if you were. We're now into spring, and it's our theme. If you look outside, spring looks like it's already arrived in Vancouver. Cherry blossoms out the seawall, packed with runners preparing for race season, and the days slowly getting longer. Spring is an amazing time of year, an amazing time for you to do something to make yourself not just feel better, but be better. Spring cleaning at the Integrative Naturopathic Medical Center has everything to do with cleansing. So let's talk about the basic principles of cleansing and detoxification and organs of detoxification. Well, why is cleansing important?
Well, from our perspective, every once in a while, we've really just reached a point where our bodies need to go through that extra step of, encouraging more detoxification and cleansing. We're exposed to things in our day-to-day life, some things that we're acutely aware of, but a lot of things that we don't necessarily think of as being toxins. And, so we're constantly eating things and putting things in our body and on our body and breathing things that, increase this sort of toxic load in our system. And, once or twice a year is a great plan to give your body that extra little boost it needs to eliminate all of those waste products and those toxins from your system.
I think people can get the idea that, well, a toxin, that would be something like an industrial waste or something bad in the water or pesticides on our food, or, if we're listening to the fast food people, that they no longer put hormones or antibiotics in their beef. So I guess if they're doing all that thing, then, really I don't have to worry. Do people really understand how many toxins that they take in on a given day and what they are? Perhaps our nutritionist can talk about this.
Often I feel that people are actually very surprised about how many things that are in our daily lives contain toxins. So yeah, there are those obvious sort of like industrial waste toxins or things like that. But even in this day and age, we're exposed to toxins on many different levels every day, all the time. So from our food, so pesticides and other chemicals that we're exposed to from just eating food, poor quality water, so things like chlorine in our water, which is there for an excellent purpose, but can be toxic nonetheless. Even things like cleaning products and conventional beauty products all contain toxins. So, on a daily basis, the average person is exposed to a lot of toxins.
And things like mold.
Absolutely. Environmental. Yeah.
Everybody's got mold to some degree, I think, in their home. Doesn't matter how clean they keep it or how dry they keep it. There is and at certain times of the year, I would think it's more prevalent.
Absolutely. I mean, we live in such a damp, moldy environment that's something that we consider as, a problem for people in terms of their immune systems. And so identifying a lot of those toxins in your environment is a really good first step. The good news is, despite us being exposed to all of these toxins, we have really, really great mechanisms in place to rid our body of these sort of waste products. So we don't want it to sound all doom and gloom.
No.
There's lots of things that you can control. There are lots of things that you can't control in terms of your environment. But as long as you do a little bit of work just to give your body that extra support, our bodies are very capable of managing those types of toxins.
Well, and is it safe to say then that not all toxins are going to affect everybody in the same way? So in your consultations with people, how do you find out, who's quote-unquote allergic or more sensitive to certain toxins?
Well, I mean, there are lots of just sort of, tests that we can do. We do a test called Biomeridian, which can test your sensitivity to different environmental things, as well as foods, of course, too. But also, we can just kind of look at symptoms. So, journaling can really help with that. Or, some people know, if I notice that when I use this cleaning product or eat this food, this symptom comes up for me. So a lot of times people hold their own answers as well.
And I suppose you are the best barometer of what's going on inside you. What do people generally start to feel where they wonder if something is poisoning them?
I think there's a range of symptoms, and these are different for everybody. But some of the things that give us an idea that maybe you do need an extra bit of cleansing support. Problems with the immune system. So maybe they're getting sick more often. Maybe they're becoming a bit more sensitive to other things in their environment. Certainly joint pain and fatigue are sometimes great examples as well. People who suffer from headaches and sinus congestion. These are just some very sometimes benign symptoms that people just sort of pass off as, it's something unrelated, but that definitely could be related to toxins in your environment or your food.
And to boomers, who of course are aging ever so slightly, even though 60 is the new 40, the longer you live, the more sensitive you become to certain things?
I think in some cases, and I think part of that is because we just have more and more exposure over time. So some of the things that we always consider is, how often are you coming in contact with something, particularly with foods and food sensitivities. A lot of people develop those sensitivities over a long period of time, and it might start off as maybe a very, very mild reaction to a food, but then as they've got more and more of it in their system, they get to a point where it becomes much more of an acute experience.
Does variety in what we do, variety in diet, help you deal with, if you eat the same thing all the time and perhaps it's got one of the toxins, the natural toxins that affect you, changing it up so in the planning, perhaps for a cleanse, do you try and get rid of everything in their system at the same time?
Well, I think that's where our approach might be a little bit different, is that we don't believe there's this one-size-fits-all cleanse or detoxification program that works for everybody. So we really work with our clients to determine, first of all, what's realistic for them, but also what might be the most important things for them to remove from their diet during their cleanse based on what they're presenting in our discussion together. So, yeah, it really depends from person to person, I think.
When somebody comes in and is looking for your help, are they asking the questions? Do you ask the questions? Is there a revelation that comes to them? Can you point to them? Look at here's where your problem might be, because they may not know the correlation between the problem and the symptoms.
Absolutely. The initial process when we have new people coming into our clinic, we go through a very extensive interview process. I guess is sort of the way to describe it. Our intakes they involve looking at health history and symptoms and family history. Certainly we have a conversation around diet and nutrition, medication. So we're really trying to get this big picture of what's going on in terms of their health, what are their major goals, and so we always have a very important dialogue at the very beginning, really where we're trying to get to know each other, we're trying to build some trust, and from there we make decisions about what the next best course is. Do we need to do more investigation, or do we need to sort of get an individualized plan right away?
The allopathic doctors, are they getting a little more in tune with, look, I've got this patient that's coming in, they're not feeling it. How are they starting to treat the revelations about the benefits of a cleanse or detoxification?
I think the really basic idea to remember about a cleanse is that we're improving the diet to some degree. And I don't think anyone can really argue that that's a good thing. So I think definitely if you look at it from that perspective, doctors are very open to, improving, having their patients' diets be improved. Yeah. So I think a lot of both allopathic and naturopathic physicians have a great understanding that the nutrition, the lifestyle, the exercise, those are a really important foundation to be building on, and from there we all have different tools in our toolkit to sort of provide added benefit.
All right, when we come back, we'll talk a bit more about the spring cleansing 101, if you will, about detoxification. How often should it happen? How do you go about it, and how do you survive if you're not taking in certain things? We'll get the answers with naturopathic physician Dr. Katie Leah and Kirsten McEwen, registered holistic nutritionist from the Integrative Naturopathic Medical Center. We'll continue on Boomer Life on CIL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.